Again, we're grateful that you joined us today. We know that this time of year, especially in the Northern Hemisphere, flight schedules are pretty busy. There's a lot of flight activity going on around the United States and North America, and probably around the world for that matter. And so we appreciate that you take time out of your schedule to join us. Today's presentation is going to honor our Salute to Excellence Golden Hour Award recipient, and then we will also have a presentation on the use of drones in the air medical field. So we will kind of expand the two topics and bring them together. Our speakers today, as always, Jim Viola, our president and CEO, will join us to discuss the topic. We also have a video recording. Matt Scassero and Dr. Joseph Scalea were not able to join us from the University of Maryland. They are the Golden Hour recipients. We do have a video that we recorded previously a little earlier today with Mr. Scassero, and so we're looking forward to showing you that. And then we have Harrison Wolf, who is the Director of Global Aviation for Zipline International. He's actually in Africa right now at one of their operations. He is also author of Drones, Safety Risk Management for the Next Evolution of Flight. He actually has worn a number of hats, and we look forward to his presentation. This is an interactive webinar. We do encourage you to ask questions. In order to ask questions, please use the question module that's part of the toolbar, either on the bottom of your screen or on the side of your screen. We do try to watch the comment sections, but we sometimes miss the questions in there. If we don't have time for your questions today, please submit them and we will try to answer as many of them as we can. We'll try to get a response after the fact as well. This webinar is being recorded. We do encourage you to share the video if you want to go back and watch it yourself or share it with others. There's a bunch of different ways. We will have it on our website. We will have it posted through social media, and we'll also have it on our YouTube channel. Easiest way to find them is at rotor.org/webinar. It'll take you to the current scheduled one, or in chronological order on the side, all of our past webinars. So now I'd like to introduce Jim Viola, the president and CEO of HAI, to join us.
Thanks, Dan. As always, it's good to be able to kick things off. Today's webinar is focused on the increasing role of UAS aircraft in the field of airborne medicine. Our speaker, as Dan said, is away, and you will hear more about that after this. But it's the UAS aircraft and the role in airborne medicine and the good things that it does for society. Now, helicopters, as well as fixed-wing aircraft, have played a significant role in medicine for decades, delivering patients and items needed for treatment across sometimes substantial or even hard-to-travel distances. That's the goodness of vertical lift, and also airplanes making that big distance, and then helicopters or rotorcraft moving it to the target of where it needs to be. It has only been recently that UAS technology has advanced to where aircraft are participating now in those air ambulance missions where they're supplementing that travel or that delivery. Today, missions for remotely piloted aircraft are increasingly significant, and their role will continue to grow as this new technology is developed, and also as the regulators start figuring out how do you allow that airspace usage with both the remotely piloted as well as the piloted aircraft that are out there. So the first element of the webinar today features the recipient of the HAI Salute to Excellence Golden Hour Award. And this is the first time that HAI has presented a Salute Award to any project involving UAS aircraft. The recipient competed against the traditional helicopter entries. This year, the recipients, Dr. Joe Scalea and the University of Maryland UAS Test Center, conducted the first delivery of an organ for transplant by a drone. Since the technology required to perform this flight hadn't existed or been proven, the test center designed and built an aircraft to complete the mission successfully. As you will see in the award video, this Golden Hour Award means something very special for the University of Maryland, because it was in 1975 when Dr. R. Adam Crowley, an emergency medical pioneer and founder of the Shock Trauma Institute at the University of Maryland, made the statement that the chances a pilot would survive increased if they received treatment in the first hour. You probably know now that this became known as the golden hour. When HAI began honoring achievements in air ambulance operations, it only made sense to celebrate the vision of Dr. Cowley by calling it the Golden Hour Award. So now, over 45 years later, we have presented the University of Maryland with an award that honors one of its pioneering leaders. One of the many great things about rotorcraft aviation is that innovative minds develop new technology to make missions even more efficient and more effective continually. From delivering an organ for transplant to delivering blood and medical supplies in Africa, people are using vertical capable drones and airplanes to supplement helicopter missions where and when they can and when it makes sense to do so. So one day, these remotely piloted aircraft will deliver medicine to our homes or carry patients from an accident scene or a battlefield to medical attention within that golden hour. So let's get started today by honoring the 2021 HAI Salute to Excellence Golden Hour Award recipient. Unfortunately, scheduling conflicts prevented the representatives from the University of Maryland from attending right now live, but we were able to record an interview this morning. So Dan, please play that interview and show the award video. Thanks.
Today we are joined by Matt Scassero, who is with the University of Maryland UAS Test Center. Matt, welcome to HAI at Work webinar, and congratulations on your award.
Thanks so much, Dan. It's great to be here, and thanks very much for the award. It's been a wonderful experience.
This is a really interesting subject for us. It's the first time that HAI has made an award to somebody who is not involved in helicopters directly. And so we are excited about this opportunity to share in the advancement of UAS operations. And so we're really looking forward to knowing more about your project. What can you tell me to start out with? How did you and Dr. Joseph Scalea get started on this project?
So we had done a project in 2016 flying a fixed wing small drone across the Chesapeake Bay with some medical supplies on it, very simple epinephrine, saline solution kind of things, just as a demonstration of concept, get people excited about it, very kind of low, but still kind of challenging. It was it was a level 2 autonomy flight across the bay. We didn't touch a thing as it flew across. And about a month and a half later, through my dean of the Aerospace Department, Dr. Norm Worley, we got a call out of the blue, just sitting in my office here one day, and hi, this is Joe Scalea, doctor up here at UMC. I got this wild and crazy idea. I want to fly an organ to a waiting patient in an operating room with a drone in downtown Baltimore. Can we do that? And literally I thought, yeah, let's try that. And my director of operations on the other side of the wall said, no. So it was an interesting start. It took us a lot longer to get there than we thought it would, but the things we learned along the way were dramatic. And that's really what led to the depth of the project.
Well, now organ transplant, now I understand that Dr. Scalea obviously is on the medicine side and you're on the technology side, but organ transplant can be something that needs to be done immediately, especially if it's the organ is coming from an accident victim or something like that. And so I know that there are time limits. And so one of the things that really makes this the Golden Hour Award special, I believe, to the University of Maryland is the fact that one of your pioneers was the person who identified that the first hour after a trauma incident can help save a victim's life if they receive treatment during that period. I kind of have to believe that's the same with the organ transplant. Is that a reasonable statement?
Very much so. Dr. Scalea's primary driver is a thing called cold time ischemia, which is the amount of time that the organ is out of a human body. As soon as it comes out of the human body on water and ice being maintained, it starts losing life expectancy. And the organ itself actually has a life expectancy. Even after it goes into a human being, there's a life expectancy to that organ in the new person. So diminishing that amount of time it's out of a human body adds years on the other end in the new acceptor of the organ. So that was his target, was reducing that cold ischemia time so they can get it into the new person get it operating and helping that person, but also extending its life. So that was his target very clearly. And being able to use a drone and designing that drone distribution system of the future will do all that in spades, whether it's intercity, interstate, international.
Okay, well, let's go ahead and take a look at the video. I know that the test run that you made that was successful actually was for a transplant that was going on. And so that is identified in the video. Let's go ahead and take a watch of the video, and then we'll come back to you after this.
Sounds great.
Helicopter Association International proudly presents the Salute to Excellence Golden Hour Award, sponsored by Rotor Magazine. This award acknowledges the contribution that best demonstrates the advanced use of helicopters in air medical transportation. The University of Maryland's campus-wide Do Good initiative was designed to develop leaders who benefit humanity by fusing ideas into real-world applications. On April 19, 2019, an idea sparked by University of Maryland Medical Center Dr. Joseph Scalea and brought to life by the university's UAS test site director, Matt Scassero, did just that. Together, the two delivered the first human organ for transplant by drone. 44-year-old nursing assistant Trina Glispie was in her 8th year of dialysis due to kidney failure. She'd begun to lose hope when a match was found. Her new kidney was the world's first drone-delivered organ, flying 2.8 miles across Baltimore and landing safely at the University of Maryland Medical Center less than 10 minutes later. Glispie's transplant was a success, and today she's thriving, enjoying a considerably better quality of life. The idea of a drone-delivered organ was born more than 2 years earlier in September 2016. Dr. Scalea contacted Matt after hearing about another successful UAS transport involving medical supplies. Could Matt transport an organ by UAS? Matt's team took the challenge. No current drone existed with the redundancies required to ensure safe organ transport. Neither was there a light yet strong enough packaging option or a way to monitor the organ now that a human wasn't accompanying it on the flight. Undaunted, the team designed a new UAS from the ground up with multiple redundancies, down to an automated and manually deployable parachute. In tandem, the team tackled the challenge of ensuring safe transport of the organ with a specialized light transport case. The team also developed a brand new medical technology not currently used in organ transport, an organ monitoring system. The new technology tracks, records, and transmits temperature, pressure, and vibration data in real time to the cloud. This data is also stored locally on an SD card for easy access upon landing. The system allows medical teams to immediately determine the health of the organ and may one day replace the biopsy that is currently required prior to transplant. Since the first drone-delivered transport organ arrived on the hospital helipad in Baltimore, members of Matt's team have gone on to continue to do good. With an investor, they created Mission GO, a company that is expanding technology for drone organ delivery and developing software that increases organ donation efficiency. The golden hour has come full circle for the University of Maryland. In 1975, emergency medicine pioneer Dr. R. Adams Cowley, founder of the University of Maryland's renowned Shock Trauma Institute, found that a patient's chances for survival are increased if medical attention is received within the first hour after an accident. This time period was later coined the Golden Hour. Please join the HAI Board of Directors in saluting the University of Maryland's UAS test site team and Dr. Joe Scalea, recipients of the 2021 Salute to Excellence Golden Hour Award.
Well, that was really impressive, Matt. Congratulations again to you and the entire team, everybody that was involved there at the University of Maryland, both the UAS Test Center and the Medical Center as well.
Thanks very much. It was a really exciting project and looking forward to continuing.
That technology that you developed is pretty fascinating. How is it being used now, or are people expanding upon this technology? How do you see it being used in the future?
Yeah, we're definitely expanding because that whole focus of doing good, technology serving humanity is something that's very near and dear to the university, but also it's actually a great use case because it makes it very easy to have the conversation with the public when they see a technology that maybe had some threatening aspects to it at one time back in our history. Now we're really focusing on the use of it. So we're looking to move forward with the actual development of the technologies, but also the development of the applications and working with the users and the end users, as well as the public and the communities and the governments to enable the regulations, but also the public acceptance of these use cases, because they are truly going to save lives and make differences in our daily lives. So I think it's very important, we think it's very important to have these public discussions and outreach activities to really get everybody on the same sheet of music at the same time.
Is there a chance that there will be a UAS aircraft available in the future that might carry full passenger or full patients from, say, the scene of an accident or a battlefield?
Most definitely. In fact, one of the early questions was when will we see the first patient being carried on a drone? And one of the interesting things was when the K-MAX helicopter was being used in Afghanistan and Iraq to haul logistics supplies, and a 6-month demonstration program became a 3-year operational program. They asked a general, hey, would you ever use these to haul a wounded Marine back to a medical facility? He said, if that happened today, and this was 4 or 5 years ago, he said, if that happens today, I'm pushing that ammo and beans off of that pallet and putting that Marine on there to save his life. So they trust the technology. So I think that's the really key piece is how do you fit the trust with the use case, with the technology?
What other kind of projects do you have on the horizon there at the test center? I know you guys are always working on something new.
So we tend to focus on the very finite technology pieces and working on specific use cases, things like that. One of our most exciting things, besides the NASA, NOAA, and DoD work that we do, is a large project called the Chesapeake UAS Route Network, which is actually taking what some other states have done in corridors and kind of set aside airspaces. We're looking to really put it on steroids, and we're actually looking at the Chesapeake Bay, establishing a route network overlying the bay. And we're already talking to other states, Pennsylvania, New York, New Jersey, Delaware, looking south down into Virginia, to expand this route network to really focus on true integration into the airspace, not just segregated by exemptions, but on demand, BD loss, flight over people, the whole thing. Multi-year, multi-phase, but we're getting them started.
Okay, Matt, I appreciate your time. I congratulate you, Dr. Scalea, the University of Maryland, the entire program, and obviously wish you all the best moving forward in the future.
Thanks very much, and really appreciate the recognition by HAI, and I look forward to working with all of you. Fly safe, everybody.
And same to you. Thanks so much.
Okay, I think you can understand why the selection panel presented the Golden Hour Award to the University of Maryland Test Center and Medical Center. I'd now like to introduce Harrison Wolf from Zipline International to bring up his camera and begin his presentation. Hello, Harrison, where are you today?
Hi, I'm dialing in from Nairobi, Kenya. I just arrived today from Ghana. So it's been a long day, but I'm really excited to be here with you all. Can you see my screen?
I can see your screen just fine. I will back out and let you do your presentation.
Fantastic. And you know, I've been aware of the Maryland test site and their experience delivering organs, and you know, I applaud the recognition to them. They've done a tremendous job in being able to serve patients here in the United States is no small challenge. So that's fantastic. And you know, I was telling Jim and Dan earlier that my first experience engaged with HAI was when I was teaching at the University of Southern California in their Aviation Safety and Security program, teaching safety management systems for remotely piloted aircraft, and was asked to be a part of the UAS executive committee with HAI to sort of look at this new broadening landscape. And so it's really nice to be back and speaking with you all today. So in January, I joined Zipline. I'm the director for global aviation policy. And what that really means is that I get to talk about all of the amazing things that our actual pilots and operators do every day on the ground and in Rwanda 24 hours a day, at night, very close to city center, and at scale. Here you see sort of our drone. You'll get to know this pretty well. This is what we call zips. So I'm going to not refer to them as drones. For us at Zipline, these are called zips, and they're housed at what are called nests. The nests is what's behind me in my background is an example of that. It's a distribution center. It's a blood and medicine storage facility, and it's a launch and recovery site. And to date, we've been operating for roughly 4 to 5 years, mostly in Rwanda, more recently in Ghana. We've had over 160,000 commercial deliveries, and more recently launched in the United States and North Carolina in partnership with Novant Health. And of those 160,000 deliveries, we've been able to deliver 970,000 products, whether that's blood, vaccines, medicines, COVID test samples. And most recently, we were the first operators to deliver COVID-19 vaccines in the world via drone. That was in Ghana, out of the facility I was visiting earlier, Ghana 1, which is one of, I think, 4 today in Ghana, expanding to 8 very soon. And 1/3 of these deliveries are life critical, meaning they're on-demand orders. So 2/3 are scheduled deliveries. They are resupply to rural health clinics. And I'll show an example of how that logistics systems work. But I think what's really interesting is that it allows logistics systems like ministries of health to rethink the way they purchase and deliver services and goods. That bottom line, 98% reduction in blood waste, I think, is something that I like to point to, because in a country like Rwanda, where post childbirth hemorrhaging is a leading cause of death for women, it's mostly because you either don't have the right blood on hand or you don't have access to blood at all. And so what Zipline has been able to do is create a resilient supply chain through the air that connects centralized clinics or centralized storage facilities supplied by the Ministry of Health to these rural clinics, so that doctors no longer have to over-order blood. They don't have to order the wrong kind that may go to waste. This causes less shortages elsewhere and really has a systemic effect that saves lives. What we look to is instant access to medical supplies. Really, any of our flights mean that a customer clinic will put in an order and within 30 minutes, generally, will have whatever they ordered on hand. This generally turns a 7-hour trip into roughly a 30-minute trip. And it's a lot more reliable during climactic weather events and things like that. Presents cost savings. And, this is sort of the value proposition that we have as a company in enabling drones to deliver goods. But I think it's also very similar to what any delivery system would try to do, right? Save money, increase reliability, and do so in a green way. All of our aircraft are electric, and they're all flown by local pilots who are trained by Zipline. In Ghana and in Rwanda, I mentioned that we've delivered COVID tests, more recently COVID vaccines. We've been able to disrupt and create an entirely new form of distribution in Ghana, where we're actually the most trusted cold chain suppliers in certain regions in the country. So now the government is actually asked us to house much of their goods, help facilitate where and when to deliver, and then provide the delivery. Now, I think what you're most interested in probably is how we actually do it, right? Not so much the use case, but really the way we enable it. We have what are called nests, or these distribution centers that again are part medical warehouse and part drone port. And this is where sort of all the magic happens. Each nest has a number of drone bodies, which are contained in 3 parts, which is the main styrofoam piece with the tail attached, and then a battery that goes in and a nose cone. And so those things, it makes it so maintenance is very easy for us to handle. Parts can be replaced in a very quick way, and it allows us to maintain airworthiness in a much more simplified way than if we had, you know, what we initially had, which was 26 different parts. At each distribution center, we start by operating at 12 hours a day, 7 days a week, which gets us to about 150 deliveries per day. Currently in Rwanda, we're able to do 24 hours a day, 7 days a week, which is about 500 deliveries a day possible. We generally have anywhere between 15 and 20 on average as the maximum for drones flying at once per operator. I think this is something that is a little bit different than many other operators in that, you know, we have found a way to enable our pilots or operators to be sort of mission controllers and to maintain vision over the system and put a lot of the decision-making in terms of flight planning as it goes on onto the aircraft once the various options are uploaded. Our one-way service radius is 85 kilometers. We cruise at a speed of 110 kilometers per hour. We have a total payload of 1.8 kilograms. And we've never had an injury or death to date. I should also say that it's not very well known, but the border between Uganda and Rwanda is responsible for a disproportionate number of thunderstorms in the world. I believe the number is something like 40% of the world's lightning storms occur on this border, which is where we operate. So it's really important for us to have a robust system that can operate in heavy wind, high temperatures, and a number of inclement weather conditions. We recently started flying in North Dakota for our cold weather testing in partnership with that test site too. Oops. You can see these are the operations in the country for Rwanda and for Ghana. Rwanda, we have 2 centers that cover the entire country, which is now we're actually up to 25 million people in range of our deliveries. Some of this slide is a little bit out of date. Again, it's 160,000 plus deliveries. And we're up to 6 fulfillment centers in Africa. We've got 4 in Ghana, and we're looking to expand that soon. We recently announced expansion into Nigeria. Again, the throughput is about able to ship 1 ton of goods per day from each distribution center. We serve both acute care, ambulatory clinics, and looking to expand potentially to patient homes, where we could deliver medication to the front door with highly precise drops. And we just announced a partnership with Walmart as well to look at Arkansas. Our deliveries to date have gone on this curve. So in 2017 is really when we started in Rwanda. And in 2021, we're now up to 160,000 deliveries. So in the United States, our operations are in North Carolina. Currently, we've flown over 5,000 miles. We are part of a PPE delivery operation in partner with Novant Health. And we have about 14 miles of routes. We're heavily limited, I would say, in the United States compared to our operations abroad. I think there's some good reasons for that. You know, the United States has a rather complex and congested airspace when compared to some other countries. And there's just a lot more stakeholders that need to be engaged through this complexity, which is one of the reasons it's so exciting to talk with you all today. There's also a beyond visual line of sight aviation rulemaking committee that's going on right now as we speak. And I know HAI is a part of that. Zipline is a part of that as well, trying to look at how we as an aviation community can do this safely and securely and serve the people that we want to serve. Again, this is the system. This is getting in a little bit into the safety and security components, or the safety components rather. We have redundant motors. We have a parachute landing system. So if anything were to go wrong, either the operator recognizes it or the system itself recognizes that it can't make a delivery, can't return to home, then the parachute, a para-land will be initiated. And this comes down softly, it lands, doesn't damage the aircraft or the payload inside. Everything has redundant pieces, so there's no single point of failure on these aircraft, which I think is an important factor when we're talking about scalability and reliability and safety. I did want to show one view of our operations in Charlotte, North Carolina. This is our distribution center there, and if you look closely, you can see what it looks like when our drone is launched. So coming off of the launcher, it kind of glides off, and you can see we're very close to roads and you know, close to homes, and our noise signature is surprisingly low. You know, to be this close, I think, you know, you would never hear us be over there. This is an image from our Walmart collaboration. So this is Zipline's installation in Bentonville, Arkansas. You can see the catapult, or you can see in this picture very easily the capture system. The capture system is a wire that's autonomously guided to meet the aircraft. The aircraft flies in and is captured, and then the motor is disengaged, and the aircraft, you know, very gently comes down, and then operators go and pick it up and take it apart and for post-flight checks. The idea here would be Walmart. You'd order something from Walmart and it would be delivered via Zipline. I wanted to give you a close-up on what this actually looks like. On the left is the flight launch. You have an operator launching from an electric catapult system. That person is in communication with air traffic control. We've gotten an okay. This is the package delivery in the middle. Package is released. The idea is to be as accurate as within 2 standard parking spots is for us to land. And then finally, the zip recovery on the right, which is meeting that wire, disengaging the engine, and then a nice sort of kinetic energy transfer in a pendulum and capture. Now, I know on your minds, I'm sure, is safety, right? Like, how do these things maintain segregated airspace? How do we ensure that we're not flying into each other? So I think there are both strategic and tactical mitigations that are put in place. The first of which is very well-defined flight paths. So each green line is a potential flight path that our aircraft can take that's been approved by the Civil Aviation Authority. You'll notice that the red then is the decision, is where the decision or optimal paths are in weather conditions. So those are the most likely to occur, but those green are possible, both emergency conditions, landing zones, and then decision points that the aircraft itself can make with operator oversight and input. You'll also see some circular areas that are sort of cut out. Well, those are areas like schools, national parks, military zones, basically whatever the government says, hey, you cannot fly over this area, it's a keep out zone. And so, you know, we're very respectful of that, and it's a key strategic mitigation for us. And then while in the air, the zips are flying along the specific preset that we call a transit plan. And we're monitoring it via what we call Birdwatch, which is our sort of electric platform that monitors all this. Each zip has flight control software that is responsible for making the zip follow the desired path. And if it strays too far because of headwind or because of some technical issue, it'll trigger an exception that the operator will then have a decision point. So when it comes to tactical, or I guess still strategic in some sense, mitigations, you know, no single point of failures. The regulators define no-fly zones. We have a robust training program and continuous improvement for flight ops. We have a very robust safety management system that's in place. Our route design is in partnership with regulators and air traffic controllers and the community. We have community champions and are engaged directly with community stakeholders. And then finally, Zipline coordinates active flights with air traffic control, and HTC can see all of our flights currently. We have a 2-week-long mandatory flight ops training for everybody in the company. They get sent to Rwanda and Ghana, so everyone in the company knows how operations work. And then there's specialized training and ongoing training for people who are directly responsible for maintenance or for flight ops and oversight. And you'll notice that everybody who flies is a local community member. So these are people serving their communities with high-paying, high-tech jobs. And so it's a really, I think, important thing for us to try to give back to the local communities by creating for a sustainable future with this work. Now, if we're looking forward, I think we're looking at in-time aviation safety management systems. This is a project with NASA we're engaged with, where you can evaluate in an ongoing way risks in the airspace. So generally SMS, is pre-flight checklist, it's ongoing hazard identification and risk mitigation, and then post-flight and hazard reporting and things. But this is a system that is automated and looks for high risk inputs that then are calculated, high risk associated hazards that are put into the system and integrated with a centralized UTM or unmanned traffic management service that is being developed by NASA and private companies. We still are lacking a robust system-wide data sharing and safety promotion system. So there's not great community sharing of data. I think that's something that we're really eager to do is try to engage other companies to share safety data so we can all develop a more safe and inclusive industry. Rapid iteration and design is really a huge challenge for regulators. As we're going through a type certification process, the type cert that you can get, let's say it takes 2 years, the design of the system will be outdated then by a year and 6 months likely, right? So FAA is adjusting. It's great to have FAA partners and civil aviation partners all around the world who are looking at this new task and really saying, we have to distinguish between non-safety critical upgrades and safety critical upgrades so that companies can make their aircraft better and more reliable without getting in the way and slowing things down. And then finally, I would say 2 things: UTM integration, so a robust integration of deconfliction measures to increase awareness with both crewed and uncrewed aircraft, and search and sense and avoid technology, I think, is certainly maturing and is coming, right? I think the only way to scale to a point where everyone feels comfortable and safe is if these aircraft can sense and avoid crewed aircraft, because I think that if we try to get to a scale where we're saturated airspace, although it is quite a large area, we'll see incidents and accidents that we certainly don't want and that will really hurt and potentially kill the industry. So I think the last slide I have is our goals. Our current operations are 14 CFR 107 ops. We've got waivers and we've got some early type cert elements. We're flying 1-to-1 in the United States, but our future operations, we're very hopeful that we'll have a Part 135 air carrier cert and an aircraft type certification, as well as production certification, and flying one operator to many vehicles, in the near future. Thank you very much. I hope I wasn't too boring. I think this is important stuff, and I really look forward to answering some of your questions. And if you ever have questions, please reach out to me on email. I'm always available, or I try to always be available. Thanks.
I suppose it depends on what time of night or what time of day you are, where you are around the world. So, no, that was a great presentation, Harrison. Thank you so much for being a part today. We do obviously have some questions that came in. And I'll jump into one of them right away because you were just talking about the certifications here in the US. From Stephen Kusick, does your US system squawk ADSB or have other transponder codes?
So it's a great question. You know, the International Civil Aviation Organization recently put out a state letter that said they highly discourage civil aviation authorities to allow drones or small unmanned aircraft to use ADSB out. So because there's concerns about oversaturating that spectrum. So we don't squawk ADSB out, right? But we do have ADSB in. So we can see any cooperative aircraft, and we are extremely comfortable of being able to avoid and plan ahead any cooperative aircraft. I think where it becomes tricky and where we need the detect and avoid technology is for uncooperative, or, you know, I think that that term is kind of not appreciated in general aviation. I'll say, you know, non-communicative aircraft rather than non-cooperative. But yeah, so that's really the sticking point for us. We would love to be able to send out a data feed that everybody would look towards. And that technology, I think, will come shortly, but it's not available today for drones.
Okay, and obviously quite a number of our attendees are helicopter operators. They're operating in the same airspace that you're working in a lot of time, we think. What are the general altitudes that you're flying at?
Yeah, so we don't go above 400 feet because of the Part 107 sort of regulation. When we move to a Part 135 operation, that may change based on the operational approval as we get it. I think there are definitely benefits for us because it allows for a more it allows for the operation. When the land is uneven below you, it allows you to fly straight but higher than 400 feet. And so there's some benefits to that. But right now, we don't see a benefit to flying higher than 400 feet, and certainly lower than 400 feet is possible. When we make our deliveries, actually, now that I'm talking, we generally fly at about 300 feet above. And when we deliver, we spiral down to 150 feet. We drop our package and then come back up in a spiral to our cruising altitude.
Okay, and somebody asked about your drop rates. Are you fairly successful, or what, if you do have misses, what are some of the leading causes for your misses?
That's a great question. So I'll separate that into two things, right? One is accuracy and one is pass fail. So to my knowledge, we haven't had any non-deliverable packages because our systems will check based on weather conditions and known tolerances what we're capable of doing. However, and maybe our engineers wouldn't want me to say this, I think our drop accuracy has room for improvement. I think that our ambition is to always 100% be two parking spots in radius. But sometimes I think we're always within 4, but not always within 2.
Okay. Do you either here in the US on the test program or overseas, are you operating at night or do you operate under BVLOS?
So we have a waiver that we're hopeful will be approved for beyond visual line of sight without visual observers. Right now we operate long distance, but with visual observers. We operate at night in Rwanda, so 24/7 in Rwanda. We operate at night. I don't believe we operate at night in North Carolina, which is our operational US facility. Yeah, I think that answered your questions.
Mm-hmm. You may have to bring your slides back up because Anthony De La Pena is asking, are the programs you mentioned in the next to last slide offered here in the US? And I apologize, I don't recall what the programs were in your next to last slide.
Okay, wait. Oops, sorry. You're talking about which?
It just says, are the programs you mentioned in the next to last slide offered here in the US?
So these maybe?
I think
US.
my guess is it was probably your slide 20, where maybe it's your own operating procedures. I would think it would be that one, perhaps not that one, perhaps, but the what's the title? Forward-looking layers of risk mitigation. Is that something that's done overseas, or is that something that's done in the US, or
yeah?
both?
So UTM is a NASA project with private industry. It's an evolution of the LANCE, low altitude air navigation capability, or an airspace notification capability, I believe, which is essentially how drone operators can request clearance or request to fly near airfields, right? And so and that's an app-based system. What UTM hopes to be is basically an automated air traffic control. And so, you put in a proposed flight route, all of your approvals, all of your profile as a company, what you're doing there, et cetera, and it'll prioritize or allocate airspace to you to fly. And then that would be also populated for crewed or uncrewed access, right? That'd be a public thing. The in-time aviation safety management system, that is a forward-looking initiative from NASA, where basically it would be, in my opinion, the necessary risk brain of UTM. If UTM is going to be what they want it to be, then you have to have real-time risk analysis via computer. But none of that is happening yet. Companies, I think most of the companies in this space, including ours, have a very healthy respect for safety management. I think there's a huge difference between those organizations like Zipline or Google Wing or Amazon Prime Air, and those hobbyist drone pilots, maybe Part 107 operators, the people who I think just want to fly and take pictures and which I have nothing against them. I was one of those people. But I think there's a massive difference between a single person wanting to do some photography and a company wanting to deliver blood at scale, right?
Indeed, that makes perfect sense. Okay, well, I appreciate your sharing your screen again. You've mentioned the regulatory side here in the US with the FAA. Are there similar regulatory requirements in Africa? The different countries there?
Yeah, so that's actually a huge problem, is that every civil aviation authority has a different set of regulations. And so I think one of the reasons I was hired is to try to move towards a harmonized approach towards UAS regulatory landscape. ICAO has put out a model drone regulation that I was a part of supporting when I was at the World Economic Forum. I published some work with the World Economic Forum called the Advanced Drone Operators Toolkit, which is free that people can review. And have had the privilege to engage with civil aviation authorities throughout Africa and South America. And the biggest challenge is that civil aviation authorities around the world have varying degrees of resourcing, right? So the FAA may have 200 people or 100 people working on drones, working on UAS. EASA might have a similar amount, but in these places, there might be one or two or nobody tasked with UAS. And so it's really important to harmonize. And I applaud ICAO for developing their model drone regulation. I think there's some changes that could be made to enable things like what Zipline currently does, that we're advocating for and that we're working with ICAO to try to move forward. And we're looking forward to supporting the ICAO model drone regulation with other regulators across Africa. Otherwise, it's a 6-month conversation of here, this is how this country does it. And this is how we, from the beginning, and it gets really complicated really quickly.
I can imagine. Can you talk to us about weather minimums with your aircraft?
Yeah, so now we're getting into sort of the operational specifics that I knew when I wasn't so tired. I hate to give you a wrong answer. And so that's, I think, one of those questions that I'm happy to follow up with, but it changes. It's different in every place that we operate, right? And so I focus mostly on our international operations. And I think what you're asking is mostly about our US operations. I believe that currently our commercial operations under 107 are limited to VMC conditions, or to nominal conditions. In Africa, we fly through rain, we fly through lightning, we can fly through thunderstorms and heavy winds. It does affect our performance. We have to take that into consideration. There are some wind conditions that I think we choose not to fly through, especially crosswinds, but otherwise, that's sort of the variance.
Okay, we have another question from Stephen Kusick. Have you done any research into vertical drone systems from a drone port?
Yeah, so I personally, I've been in drones now for about 10 years, looking at research and differences and trade-offs. I think that there are some clear advantages and disadvantages to both platforms, right? As well as hybrid platforms that have both vertical takeoff and landing and fixed wing characteristics. As a company, I think we're really focused on advancing the operation that we believe we are getting very well. We've demonstrated success and through safety and reliability, in security and working with stakeholders, in not creating an injury or an accident, being able to deliver nearly 1 million products. And so, but there are very limited places where we can do that. And so right now, we believe that that we're focusing on the customers through that lens of fixed wing launch and recovery, which isn't to say that we haven't looked at vertical takeoff and landing, but I'm not aware of where that is, or if that's something that we would ever pursue. I think there's a lot of companies doing vertical takeoff and landing, in big companies like Wing and Amazon Prime Air, and so we're very happy to perfect, or try to continuously perfect the mode of flight that we're pursuing now.
I would tend to think there's got to be a lot of personal satisfaction among your crews who know that they're doing well for their communities, supporting the medical requirements for their countries. Do they ever get any feedback from the patients or from the facilities where they're delivering these products? Yeah,
no, that's probably the most rewarding part of this job, right? Our leadership team is, I would point first to our leadership team, who are extremely dedicated to medical deliveries and life-saving efforts. I would also point to our operators who come from the community, who've seen firsthand what this looks like to save lives. We have an immense community engagement piece of this, where we identify community champions on the ground, part of these communities, to sort of explain why we're there, how to order. We take orders through WhatsApp, through email, through text message. We receive orders directly. And I know that there are a number of people in my company who've been offered better paying jobs, or maybe perhaps a little bit easier hours or easier jobs. And really, it comes down to that passion to want to help. I also think that's why this particular use case will be better received by the community than maybe delivering the food or other products. Because, I think overall, if we look at risk holistically, we've directly saved many lives. Actually, they don't like it when I say saved lives, because that's a no-no in the health industry. So I won't say that we've saved lives. The doctors actually are the ones who save the lives. But we've been a part of critical life-saving services and we've never injured anyone. And so I think that, to me, shows that this is a valuable service that we can provide. And anything that your community, that we can learn from your community, we want to learn. And there are many customer stories that we share on our website. So if you're interested in this and in women who've survived childbirth or who've overcome, who've received vaccines to communities that otherwise wouldn't have, please go check out our website.
Okay, Harrison, gosh, I appreciate your time today. Unfortunately, we do have a hard stop this afternoon, so we do need to wrap up. I can't tell you how much we appreciate that you took the time out of your schedule, especially at the end of a very, very long day for you, to come in and explain more about what Zipline International does around the world. So thank you so much for joining us today.
Thank you for having me, and thank you for being a part of such a collaborative part of this industry and in aviation ecosystem. Please reach out to me if you have questions, anybody.
Okay, well, thank you so much, Harrison. Have a great evening. Hope you get some sleep.
Bye.
Okay, we will wrap up now. Do appreciate Harrison's presentation. Obviously, if you're coming to our webinars, you're always looking to stay on top of what's going on in the industry. We want to make you aware of a couple of other opportunities for VTOL news and issues. Visit rotormedia.com. We've just recently expanded that website. Rotor Daily e-newsletter sums up the day's VTOL news. And Rotor Magazine just came out. It's a great looking issue, some great stories in there. It's produced by and for the VTOL industry, so you can't get much more direct for you. We can also make these things come directly to you. Rotor Media can come to you. Go to rotor.org/subscribe, and we can get you subscriptions for the Rotor Daily e-newsletter. That's a daily aggregated email of news from around the world in the VTOL industry. We can make arrangements for print subscriptions to come to you or electronic subscriptions to you for Rotor Magazine each quarter. And the Rotor Now app is something we are just finishing up on the development of, and we think it's going to be a neat way to do it. A lot of the news that comes out in Rotor Daily and Rotor Magazine is now available in your phone on a daily basis. Take a look at that both in the iPhone and Android stores. Our webinar next week, save the date. It's going to be an interesting one. We are working with the Air Charter Safety Foundation, and they have entered into an agreement that provides HAI operator members with access to an aviation safety action reporting program. So this will provide operators with support for self-reporting to the FAA. Looks like it's a really interesting program. That's going to be next Thursday. Every Thursday afternoons when we have our webinars at 4 p.m. Eastern. We hope that you'll have time to join us. If you can't, you know where we do find the recordings. We will make sure that those are up as soon as possible. We do have a follow-up questionnaire coming to you shortly. We do ask that you take a few minutes to let us know how the webinars are going. If there's a topic you'd like to see, we look forward to working with you on those. A lot of the ideas that we have for webinars are coming from your ideas, and we are grateful for that. As always, if there's something HAI can do for you, or if we're not doing well enough for the industry, or even the international VTOL community, please let us know. The easiest way to do that is through an email to Jim Viola, the president and CEO of HAI, at president@rotor.org. Jim does see every email that comes into that box, and he does assign those emails to our staff for tasking. That's it for this week. We are pleased that you were able to join us. We are grateful that you joined us. We look forward to having you join us again in the future. Until then, we ask that you be safe, that you fly safe, and we'll see you again very soon.